Welcome to another deep dive. We've got tons of resources prepped for you, and this time we're going to take a look at chest drainage systems.
Sounds a little intimidating maybe, but
Oh, absolutely. But
these things are really crucial
yeah,
for restoring proper lung function.
when things go wrong.
Okay.
So this deep dive is, as always, for our nursing student listeners out there,
That's right.
and I think this is a really good one. Um, so let's get started. First, why are these chest drainage systems so important in the first place?
Well, it all comes down to the balance of pressure inside the pleural space.
Okay,
So that's that small area between the lung and the chest wall.
gotcha.
Now imagine a balloon. That balloon is your lung, okay?
Okay.
That balloon is inside a slightly deflated plastic bag.
Okay, I like this. I'm with you.
That's your pleural space. And that slight vacuum that's created by the bag helps to keep the balloon inflated.
Okay, I'm picturing it.
Yeah.
But what happens when that balance gets messed up?
Well, you could have air leaking into the space, right? And that's called a pneumothorax.
Right.
Or fluid could build up, and then you've got a pleural effusion,
Okay.
and then you've got hemothorax. That's when blood gets into the pleural space.
Oh, that's so good.
No. All those things can lead to a collapsed lung.
And, of course, we don't want that. So that's where our chest drainage systems come in.
Yeah.
They're like tiny little mechanics working to get that negative pressure back.
Exactly. They're going to remove anything that shouldn't be in there. Air, blood, fluid, whatever, so that lung can re-expand and do its thing.
Awesome. So there are different kinds of chest drainage systems out there, right?
That's right.
I know there's water seal, dry suction water seal,
Right.
and then even a dry suction system with a one-way valve.
You got it. There's a few different types, and each one has its own pros and cons, obviously.
Yeah.
And you're going to pick the best one for your patient depending on their needs.
Makes sense. So let's break them down one by one. What about that water seal system, the classic one?
Yeah, tried and true. The OG uses a water-filled chamber, creates a one-way valve. Like, picture this. A glass of water
Okay.
with a straw in it.
Right.
You can blow air out through the straw. You make some bubbles, but the water's not going to flow back up the straw because of that water seal.
Okay, that makes sense. So air and fluid can get out of the pleural space, but it can't go back in because of that water. Pretty smart.
Exactly. And one of the things that nurses look at with these systems is that bubbling, intermittent bubbling, good sign, means air is being released the way it's supposed to.
Right.
But if it's continuous bubbling, that might mean there's an air leak in the system.
Red flag,
That's something you got to take care of right away.
for sure. What about the other types of systems? How are they different from the water seal?
Well, the dry suction water seal system, it's kind of like a hybrid, you know?
Right.
It still has that water seal chamber for the one-way valve action, but then there's another chamber with a dial to control the suction. So you've got more precise control over how much drainage is happening.
So more fine-tuning for the patient, basically.
Yeah, exactly. You can tailor the treatment to exactly what they need.
And then what about those dry systems?
The dry suction system with a one-way valve, that's the new kid on the block. And as the name suggests, no water needed. There's a special one-way valve that does the same thing, lets stuff out, but nothing back in.
Okay,
Yeah.
that sounds pretty convenient.
Yeah, these are super portable, which is a huge plus for patients who are up and about more.
Right, and easier to manage.
And generally more comfy for the patient, too.
Gotcha. It's pretty cool how these systems have changed over time.
Yeah, it is.
So many more options now.
Definitely.
Okay, let's talk about the parts of a typical chest drainage system. What's in there?
Okay, most of them, regardless of what kind they are, they've got three main chambers.
Okay.
You've got your collection chamber,
Uh-huh.
you've got your water seal chamber, or the one-way valve if it's a dry system,
Right.
and then your suction control chamber.
Okay, so three chambers, all doing different things. Let's start with the collection chamber. What happens there?
The collection chamber, that's where everything ends up, all the air, blood, fluid that's coming out of the pleural space. It's designed so that the air rises to the top and fluid like blood stays at the bottom.
So it keeps things organized.
Yeah.
But it's not just about collecting stuff, right? Nurses are keeping a close eye on what's happening in that chamber.
You got it. The amount of drainage, the color, the consistency, all that tells you a story about what's going on inside the patient's chest. Like if there's a sudden increase, especially bright red blood, that could mean there's bleeding, and that's obviously a big deal.
So it's like being a detective looking for clues.
Absolutely. You got to be paying attention to all those details.
Okay. Next up, the water seal chamber. We talked a little about the bubbling, but remind me why that water seal is so important.
Remember the balloon in the bag?
Uh-huh.
The water seal chamber is what helps to recreate that negative pressure in the pleural space so the lung doesn't collapse even more.
Okay, so it's like a one-way door.
Exactly. Keeps the bad stuff out, lets the good stuff in, so to speak.
And the last chamber is the suction control chamber. What does it do?
That's the fine-tuning chamber. It lets us apply some controlled negative pressure to the pleural space to help with drainage. Like, some patients just need a little nudge, others might need a stronger pull.
So it's about draining at the right speed with the right amount of suction. This is where we hear about wall suction, right?
Right, and a lot of people think that the stronger the wall suction, the better, but it's really about how much suction the system itself is letting through. The wall suction unit is just the engine. The suction control chamber is like the steering wheel, controlling how much of that power actually gets to the pleural space.
I see. So it's not about just blasting it with suction. Okay, we've got these three chambers all working together, but how does this whole negative pressure thing actually help the lung reinflate?
Let's go back to our trusty balloon in the bag.
Oh, I like that analogy. Visual learner over here.
When you have air or fluid building up in the pleural space, that messes up the negative pressure, and the lung can't inflate right. Imagine someone poked a hole in our plastic bag.
Our poor balloon lung is all deflated and sad.
Exactly. The chest drainage system creates a new seal around the lung, and as that air or fluid comes out, the lung gets pulled back towards the chest wall and can start inflating again.
It's like giving the lung a little hug. Okay, now I know nurses have a really important job when it comes to managing these systems. What are some of the main things they need to keep an eye on when a patient has a chest drainage system?
Well, first off, they're always checking the patient's breathing, listening to their lungs, looking at their oxygen levels, how much effort they're using to breathe.
So basically making sure they're getting enough air.
Exactly. And they're also looking at where the chest tube goes in, making sure there's no signs of infection.
Redness, swelling, that kind of thing.
Exactly. And of course, they're watching that drainage like a hawk. How much is there? What color is it? Is it thick, thin? Any changes could mean something's up.
So nurses are constantly gathering information, trying to figure out what's going on.
That's a big part of the job for sure.
All right, so back to our deep dive. Last time we left off with a pretty intense scenario, right in the ER.
Yeah, a patient comes in, suspected pneumothorax.
Yep. And resources are limited. Things are happening fast. You got to think on your feet. So, as the nurse, what are your top 3 priorities in that situation?
Well, like with any emergency, got to start with the basics. Airway, breathing, circulation, your ABCs. Always got to make sure those are good.
Right, because with a pneumothorax, that lung function could be seriously compromised.
Exactly. So you're checking their breathing rate, how's their oxygen saturation, are they working hard to breathe, using those accessory muscles. All those clues tell you how they're doing.
And if they're struggling, that's when we got to step in.
Right. Depending on how bad it is, maybe some oxygen, maybe even a bag mask to help them breathe. Stabilize that breathing, that's the first goal.
Okay, so breathing's taken care of for now. What's next on the list?
Well, even though it looks like a pneumothorax, can't just assume, right? Other things could cause those same symptoms.
So we got to be sure before we go treating it as a pneumothorax.
Exactly. I need that confirmation. And that's where a chest x-ray comes in. STAT. That'll give you a clear picture of what's going on inside.
So the x-ray's priority number 2. Get that visual evidence.
Yep. Confirms or rules out the pneumothorax and tells you how bad it is, too.
Okay, x-ray's done. With the third thing we got to do.
Okay, so let's say the x-ray shows a pneumothorax, and it's a tension pneumothorax. Got to relieve that pressure on the lung, and fast.
Tension pneumothorax. That sounds pretty scary.
It is. Air's trapped in the pleural space, can't get out. And as more air gets in there, it starts pushing on everything. The lung, the heart, even the big blood vessels.
Oh, wow. So it's not just the lung that's in trouble.
Right. It can really affect the whole system. Blood pressure drops. That can be life-threatening. Real emergency.
Okay, so how do we get that pressure off the lung?
Needle decompression. Basically, you put a big needle into the pleural space, let the air escape.
That sounds kind of risky.
It is. It's got to be done right. Trained professionals only. But in a situation like this, it can really save a life. It's a quick way to stabilize things while you get ready for a chest tube.
So the needle decompression is like a temporary fix while you get the chest tube set up.
That's right. And once that chest tube is in, then it's all about what we talked about before. Monitoring the drainage, making sure the system's doing its job, and of course, taking care of the patient, making sure they're comfortable.
Yeah, this whole scenario really brings it home. It's not just about knowing the facts for a test. It's about using those facts to make life-saving decisions.
Right. Nursing's about thinking, adapting, being a strong advocate for your patients. You're going to face tough situations, but with the right knowledge and the right attitude, you can handle it.
Absolutely. And to all our nursing students listening, Learning all this about chest drainage systems can feel overwhelming at first, but just focus, put in the effort, and you'll get there.
Speaking of learning, let's talk about those challenges that nursing students often have with this stuff. Remember, we were talking about those aha
Yeah,
moments.
or the things that trip people up.
Exactly. One thing I see a lot is that it really helps to be able to picture these systems in your head. It's not just memorizing the words, it's understanding how it actually works in 3 dimensions.
Oh yeah, I remember struggling with that too. Like reading about the water seal chamber is one thing, but actually seeing that water bubbling, understanding what that means for the patient's lung, that's a whole other level.
Exactly. I tell all my students, get out there, watch these systems in action. SimLab, clinical rotations, online videos, whatever you can find.
Seeing it really makes a difference. It's like reading about riding a bike versus actually getting on one.
Totally. And don't be shy. Ask all the questions you can. Your instructors, your preceptors, other nurses, we're all here to help.
All right, we've covered so much today, but before we wrap up this deep dive, I want to leave you with something to think about.
I'm listening.
We talked about the technical side of chest drainage, the different types, how it all works. But what about the person who's hooked up to that system?
Ah, the human element.
That's it. We can't forget that there's a person behind all those tubes and chambers. They're scared, they're uncomfortable, they don't know what's going on.
So important to remember that.
So here's my final thought for all of you. As you get good at all the technical stuff, never lose sight of the person you're caring for. Treat them with kindness, empathy, really try to understand what they're going through.
Couldn't agree more. At the end of the day, all the technology in the world can't replace that human connection.
Well said. That's it for this part of the deep dive. Come back for the final part where we'll wrap things up and answer any questions you might have about chest drainage systems. Welcome back to the deep dive. We're going to wrap things up now with some more insights into chest drainage systems. And of course, happy to answer any questions you guys might have.
Yeah, speaking of questions, remember that one we left you with?
I do. All about remembering the human element in nursing. We can't get so caught up in the technical stuff that we forget there's a person on the other end of that chest tube.
Right, exactly. I mean, behind all those diagnoses and procedures and equipment, there's a real person feeling all sorts of things, scared, anxious, uncomfortable.
Yeah, definitely.
Right.
We're not just treating a condition, we're taking care of a person. And they need more than just the technical stuff. They need someone who understands what they're going through.
Absolutely. That human touch, being able to comfort and reassure them, it's a huge part of what we do.
I totally agree. Okay, before we finish up, I want to touch on something else about chest drainage.
Right.
We talked about the classic systems, but there's also this special one-way valve, the flutter valve.
Oh, yeah, flutter valves. Those are really cool. They're great for certain kinds of pneumothorax, especially for patients who aren't in the hospital.
So how do they work? How are they different from the other systems we've been talking about?
Well, basically, they're like a tiny one-way valve. Air can get out of the pleural space, but it can't get back in.
Sounds simple.
It is. No water, no suction, nothing complicated.
It's so much easier for the patient, especially if they're up and moving around.
Right. That's a big advantage. They're super portable. Patients can pretty much go about their normal day with a flutter valve and no one would even know it's there.
That's awesome.
And they're easy to use, too. Don't need a ton of training or anything.
So it gives patients more control over their own recovery.
Yeah, exactly. And another good thing is they're usually a lot cheaper than the bigger systems. So all in all, pretty great option for some patients.
Wow, flutter valves really seem to be a game changer. It's amazing how technology is always changing things for the better.
It really is. And that brings up another point I always like to stress. Lifelong learning is so important for nurses. Things are always changing in healthcare. New discoveries, new technology, new treatments.
You got to keep up.
Exactly. That's why podcasts like this are so great. And journals, conferences, all those things, they help us stay on top of our game. So never stop learning.
Well said. Okay, we've covered a lot of ground in this deep dive. As we wrap up, I want to leave everyone with one last piece of advice. As you start your nursing journey, remember, knowledge is power.
The more you know, the more confident you'll feel, and the better you'll be able to take care of your patients.
That's a great thought to end on. We hope you enjoyed this deep dive. This is just the start of your learning about chest drainage systems. Keep studying, ask lots of questions, and never start pushing yourself to be the best nurse you can be.
And hey, who knows? Maybe one of you listening will be the one to invent the next big thing in chest drainage. The future of healthcare is in your hands.
So exciting to think about. That's it for this episode of The Deep Dive. Thanks for joining us.